Medicine today continues to evolve because of scientific and technological innovations. One example is aspirin, a common drug that relieves various forms of pain. But beyond simple medications, modern science has also discovered more advanced solutions such as gene therapy. As the saying goes, we used to think our fate was in our stars. But in a large part, our fate is measured in our genes. This highlights how important genetics is in understanding human health. So, what is gene therapy? Gene therapy is defined as the transplantation of normal genes into cells in place of missing or defective ones in order to correct genetic disorders. In short, giilisan or gi-repair ang problematic gene para makorek ang disease instead of treating symptoms only. Gene therapy focuses on fixing the root cause at the genetic level. This makes it a very promising medical technique. Although gene therapy shows great potential for treating inherited disorders, cancers, and even some viral infections, the technology is still under study. Dagan pa kayo og research nga kailangan buhaton para masabtan kung unsa ka safe and effective ang therapy. Is gene therapy safe? Gene therapy is still being evaluated for safety. Current studies focus on understanding possible risks before applying it widely to patients. Some findings shows serious health concerns such as toxicity or poison-like reactions, inflammation, increased risk of cancer. Kay bago pa kaayo ang technique, some risks might also be unpredictable. However, medical researchers, institutions, and regulatory agencies continues to work hard to ensure that gene therapy research follows strict safety standards. Purpose of gene therapy: treat or cure disorders caused by mutated genes. Restore normal cell function by adding a healthy copy of the gene. Provide long-term improvement by solving the genetic error itself. In other words, ang goal ani is to help the body function normally by correcting the core genetic problem. The process of gene therapy. Gene therapy can be done in different ways depending on the cells being treated. First kay ang somatic gene therapy. Transfer of DNA to antibody cell except reproductive cells. Diri ang effects dili mapass on to future children. Safe for the patient only, not hereditary. Ang ikaduha kay germline gene therapy. Transfer of DNA to egg or sperm cells. Ang changes ani mapass down to children and future generations. Daghan og kanang ethical issues mao nga kasagaran countries do not allow this. Approaches in gene therapy. Ang una kay ang ex vivo gene therapy. The target cells are removed from the patient. Genes are fixed or replaced outside the body. Healthy cells are returned back to the patient. Murag repair shop sa gawas sa lawas. Ang in vivo gene therapy, genes are delivered directly to target tissues inside the body, usually kanang through viral vectors or injections. This approach kay is more direct. Diseases that gene therapy can cure: hemophilia, heart disease, certain cancers. Although not all cases are successful, these examples show how powerful gene therapy can become. Advantages of gene therapy: can treat even multiple diseases, can significantly improve a person's quality of life, potential for permanent effects because genes are corrected at the source. Ang disadvantage ani kay kanang unwanted immune system's reactions. The victor, usually a modified virus, might regain the ability to cause disease. The body might develop resistance to the new gene. Very expensive. Some treatments cost up to 2.1 million pesos or more per single use. Ethical concerns, especially with germline therapy. Stem cell therapy in the Philippines. A related issue in the Philippines, stem cell is becoming popular especially in beauty clinics. Daghan advertisements claim that stem cell therapy is a cure-all, which raises kanang concerns about safety and regulations. But nay usa ka Filipino-American doctor-lawyer nga si Samuel Bernal, an expert in regenerative medicine and law, wants the public to be cautious. According to him, stem cell therapy is not a magic anti-aging procedure. It is not a cure-all solution, and its true goal is to help the body heal itself. Also, proper molecular level analysis is needed before treatment. Only trained, licensed medical professionals should perform it. Because of these concerns, kinahanglan jud nga ang public kahibaw sa risk and limitations of stem cell treatment, especially with the rise of unregulated clinics offering unsafe procedures. Gene therapy represents one of the most advanced breakthroughs in modern medicine. By correcting defective genes, it offers hope for patients with diseases once thought incurable. However, the therapy is still under research and safety must always come first. Just like stem cell therapy in the Philippines, gene-based treatments should be guided by proper scientific evaluation, medical ethics, and strict regulation. As science continues to advance, gene therapy may one day become a standard and safe treatment. But for now, kinahanglan gihapon og careful study, responsible practice, and public awareness.